Madam President, I rise this afternoon to supplement some remarks that I made on the floor last evening about the Affordable Care Act. Last night I talked about my own experience as a young staff member in the United States Senate 43 years ago when, because I had an insurance policy provided by my employer, that policy had preventive care as part of the policy, just as Affordable Care Act policies do today. I had a routine physical checkup, the first I'd had in a number of years, which caught malignant melanoma, a particularly virulent form of cancer. Because it was caught early and because I was treated, here I am today. But as I mentioned last night, it's always haunted me that someone who didn't have insurance, a young man or a young woman somewhere in the country, was in exactly my situation. Because they didn't have insurance, they didn't have preventive care, didn't get the checkup, the disease wasn't caught, and they're gone. I find it very hard to justify that, to understand that. It doesn't seem fair, it doesn't seem ethical, it doesn't seem moral. And today I wanted to also bring to the attention of the Senate some stories from today about the effect of the Affordable Care Act in Maine, where we have over 80,000 people enrolled, many of whom had never been able to have insurance before. A young man, Whitney, who graduated from college in 2013, he says, "I graduated in a degree with wildlife ecology, but it was very difficult to find a job. Thanks to the ACA, I was able to stay on my family health insurance plan through this period of unemployment. I did finally get employed in my field, but permanent year-round jobs with benefits are the equivalent of winning the lottery." Many young people are in that situation. It even has a name. It's called the gig economy. People who work gigs, who work short periods of time, several months here, several months there, but there are no benefits attached to those jobs. Many of us, as he says, work seasonal jobs, building trails on the Appalachian Trail, rescuing lost hikers, managing volunteers, running programs for veterans to reconnect with the Maine woods. We do good work in this state. Before the ACA, we worked dangerous outdoor jobs that only provided minimum workers' comp. But with the ACA and the tax credit, I could afford a silver plan. I could get dental for my teeth, could go to the doctor again, get flu shots, and get my joints looked at. It's important to realize, Madam President, that without the ACA, this young man would have literally no options. A health savings account is unrealistic for somebody who's making $15,000 to $20,000 a year. Buying insurance across state lines isn't going to help this young man. He said, getting the ACA coverage was life-changing. I know it's not perfect, but I'm terrified of going back to where we were before, where health and financial ruin was one wrong step away. Another letter from an older adult. My wife is 63 years old. She's no longer able to work full-time. She's had major back surgery and arthritis in her neck. Because of these health issues, she had to reduce her work hours. Here's the catch-22. She had to reduce her work hours, therefore her employer dropped her from her health care coverage. We were fortunate enough to obtain coverage for her through the Affordable Care Act. It is expensive and not the best coverage. Nobody in this body says it's the best possible result and that the law is perfect. We all agree that it needs to be repaired and fixed and modified. But the writer goes on to say, it is good enough for us to know that a major health issue will not bankrupt us. We are appealing to you. This is a letter that came to my office. We are appealing to you as our representative to ensure that a reasonable replacement will be put in place when the Affordable Care Act is ended. Better yet, improve it, don't destroy it. I couldn't have said it better myself. Donald, in his letter to me, says, better yet, improve it, don't destroy it. That's what we ought to be talking about. This letter from a fellow named Ryan in north central Maine also makes an important point about the Affordable Care Act, and the term that I refer to is job lock. There are hundreds of thousands, if not millions of people in this country who are locked into the jobs that they have that they don't really like, that isn't giving them the satisfaction that they want because they can't afford to leave their health care. One of the hidden benefits of the Affordable Care Act is it has allowed those people to follow their dreams, to start a business, and not have to worry about having health insurance. He says, affordable health, this is an entrepreneur in Maine, a small business person. Affordable health care is a major roadblock to those calculating whether they can take the leap to becoming self-employed. As we prepare for next year's season, I'm about to leave my benefit-providing job in order to commit to making the volume of ice cream that we need. This is scary, and it's a difficult decision given our financial situation and the fact that we are raising two small children of 4 and 7 years old. The first comment I hear from everyone who finds out I'm leaving my job is, "Are you sure? What are you going to do about health care?" Well, the answer is the Affordable Care Act. It enables this young man, this gentleman, to follow his dream, to start his business, to commit to his business. And this is good for the country. This is a hidden benefit that's rarely discussed about the Affordable Care Act, to allow people to give vent to their dreams and their innovation and their contribution to the economy. And here's how he ends his letter. He says, "Please don't let me down. Please don't let my family down. Don't let the millions of families who are on the bottom in this country, the very ones that all of you from all the parties claim to support." He said, "I don't care about the details of how it gets done, whether the ACA is thrown out or just revised, or what compromises have to be made by either party, but please make sure there is a health care option available and that it is at an affordable price for those of us with the guts to take a stab at our own small business. The key is affordable care. It matters." As in my own case, health insurance also saves lives. There was a study done by the Journal of Public Health in 2009 that basically concluded that for every 1,000,000 people without health insurance, there are 1,000 premature deaths. Pretty easy math. Before the Affordable Care Act, we had 45 million people without health insurance in this country. And the calculation in this extensive study was 46,000 deaths attributable to not having health insurance. I am living proof of that. If I hadn't had health insurance, I'd be gone. The disease that I had, you either catch it in time or you're a goner. And that's why I'm so passionate about this, because this is just, we would not let people die in our front yards. If we saw somebody that was in danger of losing their life, we wouldn't stand by. Nobody in this body would stand by and say, "Sorry, we can't help you." But not providing health insurance to people is a death sentence to 10,000, 20,000, 30, 40,000 people. And the Affordable Care Act is now covering something like 25 million people. That's 25,000 lives saved. If we take it away, it's 25,000 lives lost. Here's the letter. "I'm a Maine woman in my late 30s who works 2 part-time jobs, also runs my own business. Because we were on ACA health insurance that had an affordable deductible, after not feeling well for a while, my husband went to a doctor and had a CAT scan of his lungs. It turned out he had a very rare form of an illness, even though he was only 38 years old. Had we not had this insurance and such an affordable premium and deductible, he would never have gotten that CAT scan done. This insurance saved his life and covered every expense we've had over the last 2 years. And with multiple stays at the hospital, 2 surgery, PICC lines, medications, therapies, the list goes on. There is no cure for what he has, but he's doing better now, thanks to the ACA." Another person from Maine. My sisters and I watched my mom die. We were physically in the room when it happened. We cried for probably half an hour straight. Before the Affordable Care Act, most of her illnesses were considered pre-existing conditions. She survived cancer 3 times, but had to pay exorbitant monthly premiums just to have to pay most of her treatment out of pocket. He said, I don't care about the ACA because of some theory or ideology. I watched my mom die sooner than she needed to because she couldn't afford to get preventive care soon enough. I watched my mom die because market solutions refused to solve her problems. An open insurance market actively refused to compete to cover my mom. The insurance market before the ACA is one of a number of factors that led to my mom's death. This is a real, physical, immediate memory for me. For whenever someone talks about health care, and it always comes to mind when people talk about it in vague terms and market forces, I'm crying, even as I write this, and it has been years. He writes to me, I am begging you, as a son who watched his mom, who was younger than me, die in a hospital because she couldn't afford the care she needed. Please protect the Affordable Care Act. Protect it as a legislator, protect it by recognizing how appointments you choose to confirm or deny will affect my family's ability to stay healthy and alive. Through grants and research, you've worked to improve access to health care. Now, please protect the ACA. Another one more. This is a letter I received back in the fall, a little before Christmas. I have an incurable, generally non-lethal form of bone cancer. Been under treatment for over 12 years, multiple surgeries and costs. I cannot afford to pay for ongoing treatment without insurance. I'm very pleased that the current ACA does not allow for pre-existing disqualification. I would hate to see that removed. Having this condition is naturally stressful, debilitating, and undesired. I do not want or need the added stress of having to worry about the details of coverage. Additionally, I have two boys, aged 23 and 26, both of whom have benefited from remaining on our family insurance policy. That is a great policy, and my boys are healthier as a result. Finally, access to quality health care is a right. It must be a right as it benefits both the individual and society. Health is the key to happiness and success, and happy, successful people pay taxes, support the government, and give back to the community. Mr. President, I understand the debate that has surrounded this. I understand the emotion. I understand the pressure that people feel in order to maintain a campaign promise or to meet promises made over the last several years. But we are not talking about maybe what will happen. We are talking about real cases, real people. I'm talking about real people in Maine, in small towns and cities. I'm talking about rural hospitals that are on the verge of being rendered financially incapacitated because if this law is repealed, it'll take away a significant part of their support. I'm talking about seniors having to pay more for drugs. But mostly I'm talking about people's lives. These cases are people that could give specific examples. There are thousands and tens of thousands and millions that we can't articulate, people who are saved who don't even know it because they went in to get that checkup, who are saved the stress of not wondering how they're going to pay for some kind of treatment. As a parent, I remember having to stress about whether to take my child to a doctor because I didn't know whether I could afford to pay that bill. And yet we all know that that's the proper course. We shouldn't have to make those kinds of choices. And we have a vehicle, imperfect as it is, we have a vehicle for providing that care. Let's slow down. Let's take a breath and say, okay, we talked about repeal, but it isn't really practical. We can't harm that many people. Let's talk about what we're going to replace it with. And the idea that we're going to repeal it today and replace it 3 years from now, that's just cruel. That's what I'm hearing from people. Don't put us through that. People who finally got insurance after pre-existing conditions, who have insurance and they have a condition now that they depend upon that insurance, let's not make them go through that pressure added to the health anxiety, the financial anxiety. We have an opportunity to rise above politics here. This really shouldn't be a political or a policy or something that divides us. There's nobody in this body who wants to see people suffer, who wants to unnecessarily put people through the pressure of both health problems and financial problems. We ought to be able to find a solution. Every other industrialized country in the world has found a solution. It's not like this is some impenetrable box. And I realize that part of the solution has to involve controlling costs and facing the fact that we pay twice as much for health care per capita than virtually anyone else in the world. That's an issue that the Affordable Care Act does not sufficiently address, in my view, and we have to talk about that. But in the meantime, let's remember those people who are counting on us for their very lives. That's a commitment I believe we can and should meet. Thank you, Mr. President. I yield the floor.